Joining us now, Republican Senator Roger Wicker of Mississippi. He supports the Senate's draft bill. It's nice to have you. Thanks for joining us.
Well, glad to be with you, and that's certainly the way I understood it. The leadership, I think, is trying to get the members to come together and have something agreed to by the time we leave on Friday.
Okay, that is a big challenge. It's sort of squaring the circle, if you will, because as you know, there's a big divide within your own party to get to that number. You said after leaving the White House meeting yesterday, quote, "We know the parts that need to move." What are those parts that you think you can actually move and change that is going to pull in enough of both sides of Republican holdouts? Because they're not all holdouts, as you know, for the same reason.
Well, that's true, yes. I think regulatory flexibility, allowing more choices in the private sector in terms of the types of policies that are offered once a state has complied with the federal requirements. I think that's one thing that'll get some conservatives on, and it's something that we ought to be able to do. There's some things that we'd like to do on the right side of the spectrum that are problems under the reconciliation rules, like selling across state lines, association-based health care plans, things like that. We're working through the reconciliation rules. But then, of course, there are people who are very concerned that we're not allocating enough Medicare money to pay for the opioid crisis. And I think those are issues that can be addressed from both angles. But here's why I am optimistic, because everybody in that room, which consisted of 46 of the 52 Republican senators, wants to get to a yes. And there was a genuine determination in that room yesterday in working with the president to see what we can do in the next few days to move the parts and get to something that we might not be 100% overly delighted about, but something that will work and make the healthcare system more sustainable, give people more choices in the private sector, and actually make Medicaid better.
Well, we'll see what you can hammer out as far as that goes. One of the senators in the room yesterday told the New York Times that the White House left that meeting with a sense that the president did not have a grasp of some of the basic elements of the Senate plan. What do you make of that?
Well, you know, actually, I felt quite the opposite. The president is not a technician, and he doesn't get down into the weeds. But in terms of dealing with the specifics that were being mentioned, I really was quite impressed that Mr. Trump was so up on the issue. So I didn't see that at all. I think obviously he's looking at it from a 30,000-foot view and what will make the system better overall for the country and for the future financial viability of the United States and our budget. But I think he knew the details quite well.
All right, so a staffer for your fellow Mississippi Republican Senator Thad Cochran told Politico that their office has received 224 calls against the Senate Republican health care bill and just 2 in favor, all in the last week. What are your constituents calling and saying? Is your office getting the same calls?
That's about right. But now let me just tell you, if I needed to, I could get on the internet and on the phone and generate 200 or 300 calls. We're trying to do the right thing for our constituents. And you know, I've been in office for a year or two now. I have a pretty good sense of what people in our state want us to do, and I think Senator Cochran does also. So we appreciate any time somebody emails us or calls us, but clearly you can generate phone calls through a grassroots effort, and that is not exactly the end of the issue in my determination. We appreciate those calls.
It's not the end of the issue, but sometimes
we don't add them up.
But sometimes it's representative of public opinion, or at least a feeling among some people. And I imagine a lot of these calls have to do with the Medicaid spending, the reduction in Medicaid spending or reduction in Medicaid growth over a long time. How are you going to ease the concerns of these people?
I would say to those people, for one thing, there was an article in one of our daily newspapers about a mom who said her daughter was not going to be covered if the Republican Senate bill passed. We called this particular woman, worked through the situation with her, and showed her chapter and verse how indeed under the CHIPS program, her child would in fact still be covered. So I think we can answer a lot of those. But also under the proposal as it stands now, which may be modified, but under the proposal as it stands now, in states that didn't expand Medicaid, tens of thousands or hundreds of thousands of people, depending on the size of the state, will be able to get off of Medicaid and have a refundable tax credit, whether they pay taxes or not, to use to buy private health insurance. Now, you can't tell me that that's not a better outcome for Americans, to have the choice of picking and choosing what sort of private insurance they'd like to have, rather than
it may be a better outcome. It may be a better outcome for those
Medicaid
people in the non-expansion states. The question is what happens in some of the expansion states. But these are the issues you'll have to work out perhaps by Friday. Roger Wicker of Mississippi, great to have you with us. Thanks so much, sir.
Thank you so much.